Part 47, Relief of Choking in Infants. Welcome to the lesson on relief of choking in infants. In this video, we will discuss the steps of back slaps and chest thrusts. How to relief of choking in infants. Step 1. To relieve a choking infant, first hold them in your lap. Step 2. Put the infant face down and the head lower than the chest. The infant should be resting on your forearm. Put your forearm on your thigh. Step 3. Support the infant's head and neck with your hand and be sure to avoid putting pressure on the throat. Step 4. Give 5 back slaps between the infant's shoulder blades with the heel of your hand. Step 5. Using both hands and arms, turn the infant face up, so they are now resting on your other arm, which should now be resting on your thigh. Using 2 fingers in the same spot as for CPR, provide 5 quick chest thrusts. Step 6. If the obstruction is not relieved, turn the infant face down on your other forearm and repeat the process. Step 7. Continue until the infant begins to breathe or becomes unresponsive. Try to keep the infant's head lower than the body when performing back slaps and chest thrusts. If you can see a foreign object in the infant's mouth and can easily remove it, then do so. Avoid blindly sweeping the mouth with a finger. Watch and feel for breathing to begin. If the infant stops responding, position them on a firm, flat surface and yell for help. Check for breathing and begin CPR. After 30 compressions for one provider, or 15 compressions for 2, open the airway and look for a foreign object. If visible, remove it and attempt to ventilate with 2 breaths. If the infant is not responsive, as they will stop moving and squirming in your arms and the body will become limp. In this case, begin CPR immediately with chest compressions followed by giving breaths. Thank you for choosing Save a Life by NRC as your provider. This concludes our lesson on relief of choking in infants. Next we will review skills training about adult choking.